With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.
Welcome to Handle with Care, Breast Cancer and Beyond. A safe place where both women and men can come and listen to real people talk about their breast cancer experience and the effects that follow well into survivorship. Hosted by Carrie Madrid, a stage 3 breast cancer survivor and founder of the CARE Project. It's time to Handle with Care.
Hey everyone, welcome back to Handle with Care, Breast Cancer and Beyond. My name is Chris Donovan, the co-host and producer here with Carrie Madrid of the Care Project Inc.org. Thank you so much for listening to the podcast. First off, and do me a favor, subscribe, rate, and review, and tell a friend about it, okay? Now that that's out of the way, this week, Carrie and I get to talk to this amazing woman named Laurie Sullivan. She's passionate about raising male breast cancer awareness, and that's because her father and her grandfather both were diagnosed. But wait, there's more. It doesn't just stop there. Laurie's entire family on her dad's side had breast cancer or tested positive for the BRCA gene. So the whole family lives on edge, making sure that they're being proactive, being that their family is prone to having these problems. So Laurie is amazing. Carrie and I have a good time with her, and we think you'll really love this conversation. So enjoy.
Hey everyone, welcome back. Hey Chris.
Hey Carrie, how are you?
I'm fabulous. How are you?
I'm doing all right, scar and all.
You got a nice little shiner there on your forehead, buddy. I can't wait to hear that story one day.
Oh, yeah, you'll hear it all one day.
Well, we have a special guest today named Laurie Sullivan. Welcome, Laurie.
Thank you. I'm happy to be here.
I met Laurie on the Clubhouse app where I was helping moderate a room around breast cancer. And I forget the specific topic, but we kind of went around the room and talked about what we were passionate about as the moderators. And one of the things was me being part of the Male Breast Cancer Coalition and raising awareness and giving support to males diagnosed with breast cancer, which is a huge part of what we do at my nonprofit, the CARE Project, in collaboration with the Male Breast Cancer Coalition. We also had some males on stage. And so Laurie came up and kind of gave a little bit of her family history. And I knew immediately we had to chat. So she is very passionate about male breast cancer. And I just want her to share why and what she would like from us as people that have a little bit of a reach. We're listened to in how many countries now, Chris?
I'm going to guess 8 to 12.
Yeah.
And I haven't looked in the last couple of days, but I know it's it's about 9 or 10.
It's doing
Good.
pretty well. Yeah.
Yeah,
So tell us, Laurie, like why is it so important to you about raising male breast cancer awareness?
I lost my grandfather and my father to male breast cancer. Granddaddy he passed in 1983 and Dad passed in 2002. The odd thing is everybody on my dad's side of the family has breast cancer, male and female. So his dad, his 2 sisters, and his mother.
Wow.
So when my grandfather passed in 1983, of course, you hadn't really heard about it. Same as like today, most people don't hear about it because it's just not out there. But when Granddad passed, I tried to get it awareness out there and stuff. And, it was just little me plugging along. And then Dad was diagnosed, well, I guess like in 2000. He knew he had breast cancer because he had a crusty nipple. Mm-hmm. Mom had just had a stroke and had her colluded carotid artery, and we almost lost Mom. So Dad knew he had to get her well because she was going to have to take care of him. So he put off going to the doctor for 6 months. That in itself can let you know how important it is to get men diagnosed as quickly as possible because they don't have as much breast tissue as the women.
Right.
So Dad, he had a radical mastectomy. It was in several of his lymph nodes. But the thing is, too, is they don't really know how to treat it in in men if you treat it the same as you do women, or differently. But then dad got so sick with it. He had kidney failure. He just had a hard time with it, and just trying to get it so that men know that what they call their pecs is just breast tissue.
Right.
And they need to examine themselves just as women do. And nobody wants to bring attention to it. I don't know if it's just, they want to sweep it under the rug, or if it's just not as appealing to people, or what. But I've contacted Oprah and Ellen and, the major media.
Mm-hmm.
And of course you don't get any response, but it's, I've run into people that don't have any breast cancer in the family whatsoever, and a man or in the family still comes up with it. So it's not like it has to be passed down.
We talk about that a lot. Breast cancer in general, over 80, I think it's over 82 or 83% is not genetic.
Mm-hmm.
It's not. And so, a lot of people, I think, are just ignorant, and they don't know that, right? Because why would you, unless you live in this land and of cancer land, right? And so if a lot of people will just think like, if they have those symptoms like the inverted nipple or the discharge or even a lump, oftentimes they just brush it off and go, well, breast cancer doesn't run in my family. It can't be that.
Mm-hmm.
We say that almost every show, like, don't rely on that. Like, everybody's at risk. If you have breast tissue, if you're a mammal and you have breast tissue, you can get breast cancer, right, Chris? We talk about that.
100%. Now, when your granddad and your dad were diagnosed, did they call it breast cancer at the time, or did they try to?
No, they called it male breast cancer. Mm-hmm.
They didn't get around it. They went straight at it.
Mm-hmm. It's what it was.
How do
And
you feel about people calling it chest cancer instead of breast cancer for men?
It's stupid.
Okay.
Yeah.
I mean, it's not chest and breast are two totally, completely different things. That's just, again, not being real with it, not being, it's like a town here in Nashville. They don't like the zip code that it is associated to it. So they changed the name of the town to a different town. It's still the same zip code.
Right.
So it's, it's male breast cancer. That's what it is. It's not chest cancer.
So you didn't have any problems with your granddad or your dad calling it breast cancer. Did they help spread that word when everything was going on? Did they? I mean, a lot of people don't get into advocacy when they have something, and I'm not saying you have to, but being that it's a pseudo faux pas with male breast cancer, did they get involved with spreading the word?
Well, granddad, of course, in '83 there wasn't a whole lot, out there, and he was the type that I don't think wouldn't have. I mean, he didn't not acknowledge it or anything. I mean, his scar, we called it a zipper. We were young, and they treated him with hormones. So we teased about if his voice changed and stuff, then we just, instead of calling him granddaddy, we think of another, more feminine name for him. So we kind of, bantered back and forth like that to kind of, help with everything, which is what you've got to do. And, dad, he never really went out and, beat the sidewalks or anything. That all kind of really happened after he passed. But he never sheered away from it. If somebody said, what did your dad die of? Or, if dad, people knew he had breast cancer, he had male breast cancer, so it wasn't something that we negated not to tell anybody. But it was after, dad died, and I became, more filling out paperwork at the doctor's office, for instance. It's, does your mother have breast cancer? Is it, sister? It's all on the maternal side. And so I'll scratch out mother and I'll put father, and I'll scratch out, grandmother, and I put grandfather, and the doctors and nurses will say, no, dear, you must mean grandmother and mother. And I said, I'm 30-something years old. I do know the difference between them. And it's my dad and it's my grandfather, I hate to tell you, but
I just expect so much more out of medical professionals, from the billing systems that we've heard where, some treatments and medications are declined initially, or referrals don't go through, delaying treatment because the antiquated system says the gender code doesn't match the diagnosis code, as if the diagnosis of breast cancer is associated with one gender. It's just so crazy to me. And you would think in this day and age, they will have updated those things, right? Including the forms. The guys talk about that all the time, the forms that they get, when was your last menstrual period and how many pregnancies have you had? And
I have so much trouble answering those questions every time I have to fill them out. I don't know what I'm supposed to say.
Right.
No.
Right.
Right.
I haven't filled them out, obviously, is more of a joke than anything else. But it's awkward. They talk about all the time walking into a room with all pink. I can only imagine back in 83 when your granddad was diagnosed, there probably wasn't a whole lot of pink at that point either. It was just probably you're going into this hospital. Do you remember him talking about any of his visits dealing with it with the hospital or anything like that?
Not a whole lot. We lived in Indiana. He was in Nashville. I moved to Nashville right about the time he was diagnosed. So he didn't say
much about it.
He was kind of a quiet guy, but he was a big guy. So it was very obvious when he had his mastectomy, that he was missing a breast.
Yeah.
And, but it was just, and then he was diabetic too. So he was fighting the diabetes and that as well. So
just makes everything worse.
Yeah, it just compounds everything. But I mean, if you talk to him about it, he would talk to you about it. Like I said, we always joked about the little ones. They always said it was a good place to lay their head because it, indented a little bit,
Let me ask you this. Did do you happen to know, did they have the same type of breast cancer?
I was looking through my dad's records and the paperwork that I've gotten, and I haven't seen anything that specifically specified what type that they had. I'd almost have to ask my aunt and see if she knows. And
I wonder if they all kind of had the same, if they all had infiltrating ductal or ductal carcinoma in type 2, I just wonder. And then did any of them have genetic testing? I know it wasn't done so long ago, but
supposedly Dad had it done. Now at Vanderbilt, when I had the genetic testing done, the geneticist says there's only one place who tests for the BRCA2 and BRCA1 gene, and that was in Texas or something. I was just looking at Dad's paperwork, and they sent it off to some other place, and so she said that it can't be right because there's only one place who does the testing, and his came back negative. So she doesn't.
Yeah. It makes me wonder. I think we were talking before on Facebook, you and I, Laurie, about my case, and I had genetic testing and it came back negative. But I also spent some years growing up in Rialto, California, where there was water contamination. And there's a big article, if you Google it, Rialto, California water contamination, you'll see that. And it was actually right down the street from my house. There was a firework plant and a tire plant. And they would take the chemical runoff and dig holes and dump it in the soil, and it seeped into the water system. Well, back then we drank out of the hose, we drank tap water, we brushed our teeth with it. I mean, there was no sparklets in my household. And there are blocks and blocks of people who have had various cancers, brain, thyroid, breast, infertility, birth defects, you name it. And so I wonder, did your dad and his sisters all had it, right? And your granddad, did they all grow up in the same place?
Yeah. And I had, before we even talked about it, I had thought about that, and I had Googled where they lived. And I know that they were doing some like pesticide spraying, different things over the fields where they grew up in Nashville. So it didn't go into a whole lot about different people having the different cancers. I didn't really know which way to go, but it makes a lot
sense. It definitely could be environmental. I mean, not necessarily
contributing to it.
Yeah, definitely. I think the environmental is but this is just my personal opinion. There is no scientific facts about this, but based on all the people I've talked to and all the stories I've read, I would just argue anyone down that environment plays a huge factor in the diagnosis of cancer.
You'd have to be ignorant to think that pumping chemicals and leftover oil and tar into the ground that goes into the drinking water isn't going to affect the human. It's going to affect us. We are carbon-based creatures. We're going to alter to whatever we put into our bodies. So Yeah, I think that when you say environmental, I think it's just stupid humans doing things more than environmental.
Yeah. We'll go with that. Oh, so now what about you? Have you yourself been diagnosed or had any scares?
I've had several, luckily benign breast biopsies, tumors removed. The thing with me is whenever they do an ultrasound or something, if it shows a solid mass, it's usually a cyst. If it shows cystic, it's usually solid. So I'm kind of a weird case in that respect, but they're following me at Vanderbilt quite closely, because is my dad's oncologist at Vanderbilt, who was the head of oncology at that time. He said there is obviously a gene that's being passed down in our family. It's a matter is, finding it. I mean, he had even suggested at a certain age that I have a prophylactic mastectomy done just to be on this, basically the safe side.
Yeah. And that kind of goes against the standard right now, which is like, it used to be kind of like that often. And now more recently, like in the last 5 years, you read all these articles about doctors and surgeons and oncologists wanting you to go more conservative, saying that studies have shown, for instance, like I had cancer only on the left side, but I had the right removed also. And now studies are showing that your survival rates aren't any higher by doing that. But I always tell them it's not just about survival rates. It's about peace of mind.
Yeah.
Right.
Now, see, my cousin, who is the daughter of my dad's sister, aunt, she had a prophylactic mastectomy done, double, just for peace of mind. Now, her mother, dad's sister, tested positive for the BRCA2 gene, and her son is a carrier of the BRCA2 gene, and he has a palpable cyst that they've been watching as well. So it's now Jennifer, my cousin, who had the prophylactic mastectomy, she tested negative for BRCA2, but because, like you said, peace of mind, she decided to have them removed. And then we would kid that we were going to do find a doctor who would give us a fleet rate and just have us both on the table and just go from one to the other. But she beat me to the punch, and I was kind of like, wait, we're going to do this together. But
I mean, the talk about being hyper aware, right? Is that even a term? I mean, you guys have to just be so vigilant with your self exams and screenings, and I imagine.
Well, and the thing is, I got to where I was doing it too much.
Yeah.
To where I couldn't tell really if there was a change, or something. So it's like I had to make myself stop and not do it every 5 seconds.
Yeah.
So that
ask is if knowing that you have that gene, is that make you more, like Carrie said, hypersensitive and almost like you're playing a crying wolf to yourself every day? You're like checking everything and you're just not sure. Did that play anything into your mental state with everything?
Always it's not as to if I'm going to get it, it's when I'm going to get it.
Yeah.
I mean, it's just how I look at it. I just feel like it's inevitable. I mean, I've had during one tumor that they removed, they punctured my lung and I nearly died from that. And I'm like, okay, so I'll die from a from a punctured lung instead of breast cancer, while they're trying to get it out. But there's just been, there's just so much that plays on your mind. And I'm one that I want to be prepared for the worst possible scenario. And then if it doesn't happen, it's a sigh of relief, but I never feel that it's gone.
Yeah. What advice would you give to someone else in your position of how to really maintain that balance of being vigilant, but not being obsessive, and managing that anxiety that can come with that, that always waiting for the shoe to drop, so to speak. Right.
Yeah. And that's a tough one. I mean, I'm very on top of it. I want to know everything. My sister, on the other hand, you have to force her to go get her mammograms and stuff. My brothers, they would just soon not know if they got it. And I'm like, wake up. There's
a lot of people that feel that way. Unfortunately, there's a lot of people that say that I'd rather not know. And I'm like, you can't, I hear you and I get it for that long, but you can't do that. Like you can't risk your life that way.
And that's what, I mean, I had even talked to a plastic surgeon about having the prophylactic mastectomy. Both he and my breast doctor would both back me if I had decided to do that because of the risks and stuff. And, and then that's one of those things, your family, it's like, well, why would you want to take them off if there's nothing wrong with them? Well, like you said, Carrie, for the peace of mind, because it's just, and it's not 100% say, you're still going to have breast tissue when they come off. So, absolutely. I mean, it's not 100% cure, but it's something.
It's something that gives you control. Like you're not in control ultimately of whether or not you're going to end up diagnosed, right? And your odds are higher than others that you could be diagnosed. So for you, I imagine making a decision like that is just one thing you can control. Like me, Mike, like me trying to manage not having a recurrence. There's no guarantee, but I try to mitigate damage and do what I can to not feed it, if you will, right?
Yeah,
well, and that's
limit the threats is what you do.
That's it. Yeah.
Yeah. Well, and the geneticists, because I didn't have the BRCA2 gene, they told me at one point they were going to put me back out in the regular population. And I told her I refused to go.
Good for you.
I wasn't, I said, no, I'm not going to go. And you can't make me.
I love it. And this is what we talk about. Be your own best advocate, right? Speak up. A lot of people just take what the doctors say and go, okay. But in this instance, that did not sit right with you. Like me, I'm 9 years out. My doctor still sees me every 6 months. She still does blood work every 6 months. I have a scan once a year. There's only been 1 year that we skipped. And then the following year, she's like, why did we do that? I'm like, I don't know. And she's like, let's get you in there just to be safe. But there's a lot of patients that they don't do that. Their doctor goes, well, you're done with treatment. You don't need any follow-up. And they can't understand why. And I'm like, then go ask them. Tell them you want blood work. Tell them you want whatever, right? Within reason. So you did a good thing.
So there for a while we were doing like a mammogram every 6 months and then a breast MRI every 6 months. And then we had so many years of the breast MRI, being okay. So we kind of backed off on that. But we do the mammograms like every 6 months. And then, so they're seeing me twice a year. So the mammogram and then the regular visit and stuff. So, they're watching me close. But it's just one of those things that, because I want to know everything there is to know. And I want everybody to know, because you don't want the lack of them not knowing is costing, men's lives. And in reality, it could be costing women's lives too, because if it is in their dad, their brother, or whatever, like in my case, there could be a gene that is being passed down.
Well, you hear it time and time again. We all need to know our medical history, our family's medical history. And families need to stop keeping secrets about health that could be affecting others, right?
It's funny you say that, because growing up, I didn't know much. I still don't know a whole lot about my family's health, but we're like talking more about it because all these things like 23andMe and I can't even name another one, but all the genetic testing and ancestry.com, all that stuff is bringing it kind of more to the surface, which is helping. But honestly, I didn't hear about male breast cancer until I started this podcast with you, Carrie. So for you to be an advocate for so long, Laurie, that's amazing.
Yeah.
So first off, thank you for that. Right. And two, what would you suggest people do to try to get the word out?
Letting people know. I mean, it's like I had said it with Oprah, for instance. They always do the makeovers, and they always do, the women's breast cancer, which they should, but why not throw in the male at the same time? Because it's, in essence, it all goes together. It's breast cancer, whether it's female or whether it's male.
Right. But this isn't, but I agree. Yeah. But we need to bring more attention to males.
And if somebody of that magnitude, or just, for the breast cancer walks or different things like that. I mean, when we walk, of course, we've got my dad and my grandfather on our shirts. And so, that brings up conversation. But until somebody of celebrityism, so to speak, comes down with it, if you come down with breast cancer, is when it might come about
And
that
then
somebody
some
hears
do,
about it.
and then some do, like Beyonce's dad, Dr. Matthew Knowles, and he refused to call it breast cancer. He calls it chest cancer in the name of marketing and thinks he's going to save a lot more lives that way because it's more palatable, if you will.
No.
Yeah, and it's incorrect and it's irresponsible in my opinion. So
I wonder how
my
many
2 cents.
celebrities out there right now have male breast cancer, but they just haven't come forward because they're embarrassed. Because with the numbers and statistics, there's got to be one or two.
I mean, there's been some in the past that have come forward and, but like the point is, I guess I get frustrated with that because I agree it would be, or it could be a great platform to really raise the bar on awareness. But at the same time, I'm just such a proponent of us everyday people just sounding the horns, and that's why we do the show. And that's why we post on social media about it. And we are allies with the Male Breast Cancer Coalition because it's the everyday people like you, Laurie, that are getting the word out. Like Pat Washburn, who's rolling around in her Marlin Mobile with her late husband's face on the hood. And, we wear our shirts from the coalition that say men have breasts too. Don't be afraid to check yourself, guys. And it's a conversation starter. And I think if anyone who listens to this podcast just tells one man or another woman, hey, did you know men get breast cancer? It's 1 in 833.
And
that's a trickle down effect.
And it's like, put a challenge out there. Those who are listening to this podcast, go home tonight, ask your husband, brother, or somebody to examine their breast and just make awareness to that. And, heaven forbid somebody should find something out, but you never know.
Right.
I mean, it's just a scary thing because when a man finds it, most of the time, it's in an advanced stage.
Correct.
Because they don't have as much tissue.
Right.
And it's easier for them to find because they don't have as much tissue.
Right.
But yet it's that if I don't say anything, maybe it'll go away.
And a lot of times they just don't know. They think, oh, it's an ingrown hair or it's this or it's that. And they just blow it off, and I mean, women do the same, but they're a little more astute with that, but men just sort of blow it off. And it's documented that men get diagnosed later stage. And as a result of that, their survival rates are less than women, even though there's more women diagnosed.
And that's like at the high risk breast clinic at Vanderbilt that I go to. Once in a blue moon, I've seen a man in there, not with another, where they actually call his name to go back. And, they've got to feel out of place because it's all women. Everything is set for women and stuff. So I think a good start too is just, like you said, the paperwork, just even in waiting rooms.
Yeah.
I
say that all the time. Stop, just degenderize it, period. I say it all the time when I get off the elevator at the hospital, my local hospital, there's the easel there with the poster board saying, don't forget to get your mammogram, women. Don't forget, it's 1 in 8 women. It's all pink. And nowhere on there does it say men can get breast cancer, let alone the stats, let alone call us, let alone we'll examine you, let alone we'll do you a mammogram. Nothing. So I call out all of the hospitals. I mean, you guys need to do better. I'm getting all riled up, Laurie.
We've spoken to many, not many, but a few male breast cancer patients, and they've gone up to the counter and they're like, yeah, no, I'm here for the exam. They're like, okay, where's your wife?
Yeah.
It's like,
yeah. Michael Singer told us that. They said, well, where's your wife? Where's your wife? He's like, for what? What do you need my wife for? They're like, well, for a mammogram. He's like, no, it's for me. Like, he should never have to explain that.
Especially in that office.
Right.
Like, I understand like maybe a private practice or something, but nothing that's catered to breast cancer and mammograms and all that stuff.
Don't they see the patient name? The patient name right there, Michael Singer.
Typo.
Unless they thought it was a typo and it should have been Michelle.
Whatever.
But, but it's like when Dad was diagnosed and I'd gone to a new doctor, so to speak, and I had mentioned to him about the male breast cancer in the family, and he's like almost like he didn't even know about it. And I said, well, okay, I need a new doctor.
Yeah.
Yeah. Because you need some education, and it's, I'm not going to educate you, but
Yeah. Give me half your paycheck. We'll talk, buddy.
there you go.
Half. Hell, take all of it. You probably deserve it.
Oh man. Well, I really appreciate you sharing this story about them. It's so important, and we've heard from other families where multiple members have been diagnosed and yet all genetics come back negative. So we know that there's got to be other genes involved that just haven't been discovered yet. Or, the bottom line is, all that aside, if you are a mammal, you have breast tissue, you can get breast cancer. Learn to do a self breast exam. Go to malebreastcancercoalition.org. There are self exam cards there. They are downloadable for male and female in over 20 different languages.
Which is how
That's
many
amazing.
countries we're in.
Yeah, exactly. We all need to do it. And if you're uncomfortable, just go to your doctor and say, you know what? I just learned men get breast cancer. Can you do an exam on me? Show me how to do it. Right? This is your health. This is not a sexual thing. This is your health, period.
Yeah. And with the way the world is and everything advancing so fast, and I mean, we were in a pandemic for a year of a disease that most of us didn't even know about that existed. Like, take care of yourself. Just double check things. And honestly, men, we're silly, stupid creatures. Like, grab your boob, play with it a little bit. Like just double check things. Like, come on.
Double check things. Double check it. Yeah. When in doubt, get checked out. I always say that. It sounds so
That's
hokey,
good. Yeah.
but it's true. It sounds silly, but you know what? It's true. It's true. So what's your final words, Laurie? What do you want to tell the world about male breast cancer?
It's real. I mean, it's there. It's not just a woman's disease. Like you said, it doesn't
discriminate.
It doesn't discriminate. Yeah. I mean, so don't be oblivious to it. Be aware, research, but the main thing is just to examine yourself, to know your body, and not be ashamed or afraid to do a breast exam. To me, is a silly thing, because it's just touching like your leg,
right?
It's just in a different part of your body. So
absolutely.
And then just being aware as to how it is. But men do get breast cancer. It's a real thing. It's not a made up thing. And it's a sad thing that more people are not aware of it, and that the media doesn't bring awareness to it. And those are the ones I blame, because those are who people listen to. And that's where they go to learn about stuff. And the media is doing a big disservice to the male population.
I totally agree.
By not talking about it.
I totally agree. It makes me crazy. Even great morning shows like Good Morning America, with Robin Roberts, who I adore. And I wish I could meet you, Robin. I wish I could meet you, Robin Roberts. But, I mean, she is an advocate, and she has spoken about male breast cancer. Brett Miller's been on the show from the Male Breast Cancer Coalition. But the producers of that show, still, when they do their big breast cancer awareness, it's everything pink, everything feminine. And I'm a female, and I hate pink. I don't want to go to a breast cancer event that is nothing but Pepto-Bismol pink. Stop it already. Let's defeminize this disease. It's not a female disease. It's not, and every female doesn't like pink. I say it all the time. I know everybody's sick of hearing me say it, but I don't.
I say we give it an accent color. Let's throw in a blue. Let's just give it let's give it a border of blue or something.
That's why my logo at the Care Project has blue around it. It represents the so-called 1% of male patients.
So I think when they do that show, we should all show up and take over.
Let's do it. Let's do it.
I know how electronics work.
Yeah. I've got blue lights under my desk right now, sparkling.
I can see them. They look great.
Right? I do blue everything. Well, thank you again so much, Laurie. We could talk to you all day, but let's get off of here and let's get busy, and let's just keep spreading the word. We'll use our social media. We'll get on Clubhouse. We'll have you there. Chris and I are going to host some rooms, and we'd love to have you come in and share more of your story and let people ask questions, and if anyone has a question for Laurie, just get in touch with me at thecareprojectinc.org, and we will get you in touch with Laurie. And if any media outlets are out there, that want to feature this story, get in touch with me and we'll put you in touch with Laurie.
Yeah.
Right?
That'd be amazing.
I mean, it's having two men in the family lost because of that. That's it's odd to think about, but it's sad that the whole family has it, and you just can't get the word out. Just nobody says anything about it. So it's just, I don't know. It's just something has to be done. I don't know what exactly, but
well, keep doing what you're doing. Keep talking.
Shake
to
some trees.
Yeah, shake some trees. Keep yelling. Keep talking. I'll cuss for you. I
have no problem in that.
Will.
That respect.
And Chris will make it into a promo.
Yeah, right.
But yeah, no, we will definitely share.
I'm an ex-Air Force wife, so I've told people I can take them under the table if they want.
Okay, well, we might take this off air.
Yeah, right. You can outswear a sailor here in a minute.
Right. Oh, well, thank you so much,
Well,
Laurie.
thank you. I appreciate it. And y'all have a good rest of the night.
Thank you. You take care.
Call me anytime. Bye-bye.
Bye.
Thank you for listening to Handle with Care, Breast Cancer and Beyond. Please let us know what you think of the show by leaving a rating and review. And don't forget to share it with a friend. For more information or to connect with Carrie, go to thecareprojectinc.org.
With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.